All right, welcome to week 10, module 10. We have two more modules left and we are done for the semester. So we're approaching the finish line. All right, I'm going to share my screen here. Okay, so this is module 10. We will be discussing the two chapters in Giddens, chapter 27 and chapter 28. Be sure to review these objectives here, the learning objectives, and make sure you understand them. Chapter 27 discusses tissue integrity. Be familiar with the definition. And just remember that tissue integrity ranges from partial thickness injury involving the epidermis to a full thickness injury involving the dermis and below. Review the normal physiological process in figure 27.2. And now we'll be discussing the age-related differences. So in infants, they have thinner, more permeable skin with less subcutaneous tissue. They are at higher risk for fluid loss and thermal regulation issues, and their skin is usually smooth and dry, while the older adults have thinner skin. It's less elastic. They have decreased strength. They have decreased subcutaneous tissue and less lean muscle mass, which can cause the skin to hang. There is a decreased sebaceous activity, which usually results in dry, itchy, rough skin for the older adult. There is also less perception of pain with decreased venous and arterial flow. This causes slow wound healing and it increases the risk for injury as well in the older adult. There are 6 categories, which can be partial or full thickness injuries. One of them is trauma injury, which ranges from a superficial abrasion to a deep wound, such as a gunshot wound. Then there is lots of perfusion trauma injuries as well, such as a pressure ulcer or necrosis from a blocked arterial blood flow. Then there is immunological reactions, such as rashes, hives, and it can, even go all the way to Stevens-Johnson syndrome, which is caused by a medication drug allergy. Then there is a category of infections and infestations, such as fungus infections, thrush, scabies, head lice. It can even range to herpes simplex 1, which is a cold sore on your lip, or herpes simplex 2 that is located with genital herpes. There are thermal and radiation injuries as well, and it can range from sunburn or radiation treatment. So you can have a radiation burn, which can be given to treat tumors, or there can even be burns caused by fires thermally. There are lesions such as benign tumors to skin cancers such as melanoma, basal cell, and squamous cell cancers. And just remember that when tissue integrity is impaired, a number of body functions are affected. This can include thermal regulation, elimination, fluid and electrolyte imbalances, protection from infection is impaired, safety is compromised, comfort and pain can be altered, and body image as well can be altered. Risk factors range from diaper rash to impetigo to skin cancers due to sun exposure, to skin tears and pressure ulcers, incontinence, poor nutrition, especially in our older adults. Primary prevention is teaching good nutrition, hygiene, and protection from the sun and other environmental hazards. Secondary prevention is screening by a dermatologist, especially for those who are at high risk for melanoma. And we'll use the teaching term for education ABCDE, which stands for asymmetry, which is the shape of one half that does not match the other half of the lesion or mole. The border that's irregular, the edges are often ragged or notched or blurred in outline. The color that is uneven with shades of black, brown, and tan may be present. The diameter, there is a change in size, usually an increase. Melanomas can be tiny, but most are larger than the size of a pea, which is approximately larger than 6 millimeters or a quarter of an inch. And then the E stands for evolving. The mole has changed during the past few weeks or months. We're going to learn more about different tissue integrity in the presentations that the students are going to submit, the voiceover presentations. So it's important to know that healing occurs by primary intervention, and that's when wound margins are well approximated, such as sutured or taped or glued surgical incisions, or a simple laceration which takes place more rapidly than other types of healing. Then secondary intention is the healing process that occurs when wounds such as ulcers have distant edges and granulation tissue gradually fills the gap to close the wound. Then tertiary intention is the healing processes which occur when a wound is sutured closed much later, resulting in more scarring than that which occurs for the wound closed with primary intention. Tertiary closure is used when a wound must stay open until infection or wound contamination is resolved. Later, the clean wound is then sutured to facilitate continued healing. A bright light, a ruler, a magnifying glass, and sometimes a camera are helpful tools for skin inspection and documentation. Describing the lesion's location, size, shape, color, elevation, consistency, and pattern, describing the grouping of multiple lesions in lines, scattered, or including the color, the odor, consistency of any exudates. And just remember, there's a 24-hour time limit in a home health care, long-term care to assess the skin. Otherwise, insurance will not pay for any treatment measures that are ordered. In some facilities, another registered nurse is actually required to document a thorough skin assessment has been completed. Some of the diagnostic testing that we use in tissue integrity involved patch testing, such as testing for allergens, and that's usually done at an allergy specialist. Then we do wound cultures, and remember, you must cleanse, reduce the exudate prior to obtaining the wound culture, so cleanse the wound. And then there's various biopsies, such as an incision, excision, and shave biopsy as well. And then finally, there's a Woods lamp, which is a black light, which helps magnify and gives special lighting to identify the presence of infectious organisms and protein in the wound. So let's go to question 1. Make sure you complete this on your Word document. Oh, let me just pause there so that way you have time to answer it. Okay. All right, now we're going to talk about the concept of sensory perception. So make sure you read the definition that's listed on sensory perception and review all the normal physiological processes, and make sure you review the table 28.1 with the cranial nerves and its functions as well. We're going to be practicing this in lab for our ear, eye, throat clinic, and we're going to be doing a sensory perception test on your feet as well with the monofilament. Okay, infants and children, the development of gross visual ability to recognize objects, perform purposeful eye movement and color recognition primarily occurs during the first year of life and continues to improve by 5 to 6 years of age. Hearing is fully developed at birth and is also assessed at birth as well. It takes 3 months for a full sense of smell and taste to develop. And by 1 year, there is a well-developed sense of touch, which is associated by walking. There is a decline in sensory perception with aging, which increases the risk for falls, burns, decreased appetite, and ability to understand and comprehend education due to hearing or visual problems. There's some conditions that I have that are associated with aging. So be sure to review these terms as well, and make sure you understand that. Okay, the consequences, of course, is due to impaired hearing and vision, are falls, burns, food poisoning, hypothermia, pressure ulcers, and toxic gas exposure. Impaired vision and hearing in children can contribute to significant developmental delays and learning disabilities as well. And also with our adults, the loss of functional ability can happen. Make sure you see table 28.2, which are medications such as antihistamines that cause dry mouth and blurred vision, and antibiotics, NSAIDs, loop diuretics that can cause ototoxicity and impaired taste and smell, anti-seizure meds that can cause numbness in the hands and feet. And then we're going to practice with the otoscopes as well and doing cranial nerve assessment, and of course sensory perception of touch on our feet. Just remember, OSHA requirements require to protect hearing, vision by safety goggles, earplugs, helmets, and then for the newborn, we give erythromycin eye drops to prevent, eye ointment to prevent vision from STIs that the mom might have. There is a secondary prevention measure, a screening for hearing and vision that occurs. And then also another secondary prevention is glasses, hearing aids, medications, and surgeries to improve the sensory perception. Make sure you answer question 2 as well. I'm going to pause there so that we can answer question 2. And then these are the learning objectives. So be sure to understand these as well. And that completes this module. Thank you.